We got some people still joining, and we are live on Facebook if anybody wants to see it there. I'll keep admitting people as we have people joining in here. So as people jump in, introduce yourself in the chat or turn on your audio and where you're from and what you're up to and all those kind of fun things.
All right. We still have people coming in? All right. Are we good, Gabe?
We're good.
Oh, welcome. I hope you all are doing well. Welcome to our weekly conversation here, hosted by Team Genius. I'm Ruth Nicholson. I work part-time for Team Genius as a customer success coach, and also work with the GO program, helping youth sports organizations operate better with the off-field team in terms of governance and boards and volunteers and administrative issues. With me is Gabe Skelly. He's our customer success manager at Team Genius. I think he talks to at least 50 clubs across the US and internationally every week about what they're doing and how to do it better. So he's my partner in crime. He's also my boss. So welcome. The idea here is to have a place where you can talk about the issues you're facing, get advice from others, bounce ideas around. And normally when people register, they'll give us some hint about what they want to talk about. And this week, no one gave us any hints. So I'm going to suggest kicking it off with Gabe with what is he hearing over the last week about what clubs are facing and what they're doing. And then we'll invite the rest of you to share what's going on in your corner of the world. Looks like we have soccer, hockey, volleyball, and a local parks and recreation organization. So a really good mix of perspectives here. So Gabe, what'd you learn this week?
Lots of stuff, lots of just talking to customers all over the world. Had a lot of talks with Canadian and U.S. hockey customers yesterday. Did a big kind of group training with a lot of them, getting set for tryouts. We got a lot of people that are getting set for kind of traditional or maybe a little bit of modified hockey tryouts. Kind of showing them all the new stuff with Team Genius and finding out what's going on with those organizations. Talking to a lot of soccer customers too that are either modifying or running tryouts now, or some Minnesota clubs getting ready to run tryouts in like a month from now. So a lot of clubs that are starting to, embrace things, opening up where they are and kind of seeing what they can do to get kids out and playing. And if not playing right now, at least practicing with their coaches. I know locally here in Minnesota, I'm a big biker, so I've been biking around and I see a lot of, 10, 12 person groups, Little League practicing. My kids have been asked back to Little League to play. So the Little League seasons are starting up around here in Minnesota. Just working with clubs kind of all over in different, engaging in different levels of return to play. And then also just starting to get some questions on, what people are doing to, if they need to track, attendance as far as attendance as it relates to, the COVID-19 or temperatures or different kinds of things like that. So starting to kind of feel out what people are doing for that, what they might need to do in their different municipal areas. But just a lot of positivity. I mean, really just a lot of coaches and clubs that are super positive about getting back into things. And then a lot of, just seeing in our system, a lot of scores coming in for, end of season evals or tryouts. And a lot of people that are really excited that they're able to get back out and do some things. So I'm pumped to be able to get outside more too and do a little bit more outside. So a lot of good positive stuff this week.
Oh, so I'm going to suggest, since I actually don't have any topics from the group to go around is we pretend we're sitting at a table and we go around the table. If you all would, if I could invite you to share kind of what's going on where you are. We've got folks from Texas and Maryland and Hawaii and Oregon. I mean, really scattered across geography here. James, what's going on in Texas? What are you facing?
Well, we're still in a situation where COVID-19 has started to ramp up here again, and the governor has just limited gatherings of no more than 10 people. So some of the practices have had some issues with tryouts. Two clubs had coaches test positive, and it had to shut down tryouts during the week. And so I don't know where we are going forward. My club has been working on a contingency plan for tryouts, and then also how we're going to be testing and contact tracing going forward. But all that can change. So it's still up in the air. So kind of scary.
Oh, oh my, oh my. Hey, Joel, so what does it look like where you are?
Well, I live in Saskatchewan, Canada, so it's quite a bit different than what's going on down south right now. But where we are, it's there's only 100 cases in our entire province right now. So, but we're still not opening up stuff like full on yet. So we got a ways to go that way. It's a phased in approach. So we'll wait and see.
Oh, I am jealous. We have 10 times that in my county. Wow. So Steve, you're in Oregon? What's going on in Oregon?
You're in Washington, right? I think
I'm in Washington. I'm north of Seattle.
Pretty much the same here. We're actually the county. I manage a rec sports program, so youth soccer, basketball, baseball, softball, mostly. We're in one of the counties that it has a fairly low positive rate, and but we still aren't really open for a whole lot of activity. We're allowing teams to practice on our fields, but we're not reserving or renting those. We're not allowing tournaments in our facilities. There are others in our county that are allowing tournaments. We just didn't feel like it was the right idea, right thing to do right now. Mainly what I'm looking at now is trying to figure out how to run a youth recreation soccer league in the fall. And if we're under the same restrictions with, in Oregon, it's 100 people gathering. Trying to limit spectators at a kindergarten soccer match is going to be difficult. Parents and grandparents and aunts and uncles all come to those, and trying to keep them 6 feet apart and under 100 per field. There may be another issue about how many can be in a complex, which says 250, but we have 70 acres. Putting 250 people in a 70-acre thing, you can spread them out, but it's just a matter of trying to keep them away from each other on particular fields. So that's kind of where we are right now, is looking to the fall. We don't have a whole lot going this summer.
Wow. We just opened up in my county from phase 1 to phase 2, and now we are allowed to see 5 people outside your home a week. That was our big opening up. So I'm so jealous of you in Saskatchewan. Oh my gosh. Kenneth, what's the volleyball world look like for you? All right. Oh, he says volleyball clubs in Pennsylvania won't have tryouts until October or November. We're waiting until the school season starts in August to see how things go. Schools have been given a blueprint for fall sports, and each school has to develop their own plan for their teams. We still have a limit of 250 people to gather together, and I don't expect that to change for the foreseeable future. Not sure how that is going to impact school sports. So Pennsylvania sounds a little bit more like Oregon. So let's check in with Catherine. Catherine is in the beautiful state of Hawaii. Um,
We have less than 800 cases here, and mostly on Oahu. We do have probably less. I'm sorry for there might be noise of yard work or something. Anyway, we probably have less than 100 active cases, and probably the bulk of those are on my island, Oahu. We have begun opening up. The governor feels that we are going to have increased cases from opening up. They are really aggressive here. We are, as if you're planning your vacation to Hawaii, if you test negative after August 1st, you might be able to waive the 14-day quarantine. However, it's still in place. They're gradually opening up things, and I believe that would mean that there would be more outdoor sports, but I think that they're still separating people. I don't think that they're letting people, letting the kids get too close to each other if they're doing anything.
oh, wow. A lot of difference across the geography. In your protocols, whether it's the school developing a plan or Steve's complex developing a plan, what kinds of things do you have to keep track of or document? I mean, do you have to report to your local school district or the association for your sport? I mean, is anybody tracking the data that you're supposed to make sure you're checking on your kids? Or is it just all, I promise I'm telling the truth?
No, we haven't started yet in Texas, but for my club, but we're prepared to track it. We actually have health safety directors that are going to be responsible for checking players in, checking them out, making sure their surveys are complete before they arrive at the field to practice. So yeah, we have a lot of kids who don't have insurance, and so we're very, very concerned about our liability of making sure that we're doing due diligence. Because when a club, our opinion from our lawyers has been that if we do not provide that we have been doing the due diligence, following the guidelines that have been set out, then we could be considered liable.
Oh.
James, what do you guys have for what they want for requirements as far as what do they specifically want you to do?
Well, one of the things is we're going to be doing temperature checks, and then we have a form in which the players will fill out as if they show any symptoms of illness, that they're going to be returned away at the checkpoint getting into the fields.
Okay.
And we're going to do the same, and this is going to upset a lot of people, I assume, but we're going to do the same thing when we have our games, that even visiting teams will have to comply. So as I said, we have a lot of kids who do not have health insurance, and it's a concern for us as to, I personally got the COVID and was actually sick for 10 days in the hospital. And fortunately, my insurance covered my bills, but just the hospital bills alone were $78,000.
Oh my God,
So,
that's a lot of money.
So we're concerned about it. So we're going to be tracking, because in Texas, we're required to do contact tracing. We're keeping our cohorts together with our players and even siblings. So as right now, we're just getting started. We're going to have, you may have a U12 player practicing with a U17 player. Since it's just drills, it's no contact. That's what we're going to try to do, is keep those cohorts together, so we keep families together, and that way we don't have cross-contamination.
How has that affected your staffing, is in terms of either your paid staff or your volunteer staff? Because to have the logistics of saying there's only one entrance to a field or a group of fields and then checking, I mean, this is sounding like you need more people.
Yeah, well, we've been fortunate enough that we've got a good group of people that want to get involved. My role is I coach, and then I also, am director. But so I'm going to have to take on some of those duties as well. So I'm turning coaching over to some other, coaches that I have with me to help out on practice days, because it's more important that we follow these guidelines for the sake of, because our president has kind of said, if we get one case, we're going to have to shut down. And it's too hard for, we understand that. We understand that. And so, and then the number of cases, it was nice to see you only have 100 a day, you know, and Ontario, we're averaging about you have 100 total. We have about 500 a day here in San Antonio. It's pretty bad. It's pretty bad. In fact, Houston, Texas is now run out of hospital beds. And so they've opened up the children's hospitals for COVID patients.
I thought Houston had one of the largest, if not the largest medical facility like in the world.
Well, they might, but they have the limitations. The governor today just stopped all elective surgeries again. So, but you know, we'll see.
Wow.
I mean, we just have a lot of, San Antonio is number 3 in the country in doubling their number of COVID cases. We're about every 10 days, we're doubling.
Wow. So, Kenneth posted in the chat, we'll have to lift this out for you all, that they have a form, the school has a form for tracking players' temperatures and if they're experiencing COVID symptoms, and if they have a fever or symptoms, they sent home. And then there's a whole series of guidelines about what to do if somebody does come down with COVID or has symptoms during practice. And they're about the individual and isolation and calling parents, contacting healthcare, your physician, and before returning to athletics, they need a clearance from the physician. And that is a very short summary of what Ken put in the chat. He's doesn't have a microphone at the moment, so wow.
So Ruth, what if, okay, so in that scenario, what if a child, even though they don't have a fever, they have asthma, and because they have asthma, they cough during practice, maybe one time or a couple times, and I think I would ask James this question, what would you do in that situation? Because you hear people cough, and I will cough, and I'm not sick. And if you have, allergies can cause people to cough. And what do you do? Do you pull them, or, I'm kind of, or what if someone sneezes?
I think the occasional sneeze or cough would probably not warrant, the situation. But constant sneezing, I think the big things we're looking for are those temperatures, shortness of breath, diarrhea. Those are the main ones that we're seeing. We live in Texas. We have every allergy known to man, and we've got the Sahara dust that's coming here tomorrow. It's nasty looking, but there's gonna be beautiful sunsets. But so yeah, those type things. But it does bring us concern because we're at the liberty of people telling the truth. Mm-hmm. on their one of our bigger school districts had a graduation outdoors, and a parent admitted after graduation that yes, she was positive for COVID, and yet still came and hugged a whole bunch of kids. And so it's people are not going to always follow, and there's a lot of people out there that say, well, I want my kid to practice. I'm not gonna, if he's sick, I'm not gonna keep him home. I don't want him to miss his time on the field. So it is a concern for us. It is a concern for us. We've had 3 local high schools shut down their summer football practice because of positive test. Now, are they related to being in the group? I don't know, but it was enough that the school district shut those programs down.
Go ahead.
Oh, and some parents want to get their kids busy with something so that they can go to work or do something, and it might mean the difference between them making money and being able to work. And so they might not tell the truth, and there might be a good motivation for that, or that they may feel like it's a good motivation.
We've had some folks participate in some conversations in the last couple of weeks who have facilities that are running sports camps which in most places are a no-no. But because those sports camps also provide a daycare service, they're allowed to run because when you've got that daycare moniker on you, so it's a little of both, which is interesting as to how you're consistent and provide those things that help people continue to work and support their families.
I was just thinking back on that, kids coming to practice sick. And I think that's quite the paradigm shift. I mean, I played all kinds of sports in high school and sports through college. And remember my senior in high school, even I didn't miss a day of school, even though I was deathly ill a couple of times because we got to skip a couple finals or something. But I mean, as an athlete, it seems like a lot of times you're, proving how tough you are and you're expected to show up and do it and play at your best game, even if you are sick. So that whole idea for athletes to, if you've got a little fever or a cough, to just say you're sick and not show up, it's like very different from what I think most people have ever experienced.
Yeah. We talked a little bit last week about how do you handle as a coach or an administrator that, that can do, I'm going to play through the pain kind of attitude.
Mm-hmm.
And in the era of COVID, that's actually not what we want to encourage. So, Steve, do you feel that pressure to open up?
Going back to what he just said about the kids reporting, it just kind of reminds me about the concussion stuff that's come up the last few years too. And maybe silver lining, maybe this will open up the honesty piece about athletes actually coming forward and saying that they're still suffering symptoms of concussion. And so maybe that'll help. This is a hell of a way to get to that if it does, but it might just be something that is forcing people to be a little bit more honest about how they're actually feeling, and maybe that tough guy persona piece of athletics can get ramped down a little bit. So yeah. As far as opening up, we run a rec league, so we canceled our baseball softball season in May, and so we haven't really had much or any pushback on that. We're getting the fast pitch softball and travel baseball teams pushing to use our fields at this point. And we've just told them, like I said earlier, that the fields are open if you want to practice. Here are the guidelines, but we don't want you playing games. We don't want teams coming in from outside of other towns, other counties, other states, those kinds of things. So I know the high schools are able to begin team activities July 1st, but they are, I believe they're all with that physical distancing piece. So they're not going to be running scrimmages for football or any of that, but they are able to open their facilities. Right now, all the schools in Oregon, as far as I know, are closed to activities by the high school governing board. But again, that changes July 1st. So that's kind of where we are with things. We haven't really heard what's going to happen with fall sports. I think maybe soccer, volleyball will be allowed because they're minimal or less contact or less duration of contact. Football, I'm guessing it's probably a 50-50 coin flip on whether they're able to play football. Some say, oh yeah, we can do it. And others are like, no, there's just not a chance that that's going to happen. So we don't know.
Are you noticing any difference between outdoor sports? I mean, baseball comes to mind as you can literally stand a reasonable way apart as compared to indoor sports, things like hockey and volleyball that are, more often indoors, and that's just a different circulation thing.
Yeah, volleyball is really about the only one here. Oregon is not a big hockey place, so there isn't a whole lot of that. But the volleyball, they're being allowed again with the July 1st. They'll be able to do those things too. So originally they had said volleyball probably was not going to happen because it was indoor, but I think they've backed down on that just a bit, and because of the contact piece of it. But we'll see what happens. Numbers are going up in Oregon right now. So we could all go backwards here in the next couple of weeks.
Oh man, Kenneth has something to offer. He says a local men's outdoor adult high school started their season last week, and he's in Pennsylvania. They play on Monday and Wednesday. One player that played on Wednesday was tested Thursday and was positive for COVID. They shut down the league for this week and are expecting to restart this coming Monday. It's a local community rec league. So, wow. Wow. Catherine, did I hear last week that Hawaii is allowing inter-island travel for sports?
We are allowing inter-island travel, but keep in mind that for sports, it kind of depends because you can't, there's still social distancing and there's still, I haven't checked to see I haven't heard anything at all about really about resumption of children of youth sports. And I think we're still pretty shut down, except they gradually opened some things. But yeah, I mean, inter-island travel is okay if you're a resident and you don't have to quarantine. But I haven't seen anything about groups of like a team going and playing or anything. I think that's going to be slowly, added into the mix. I think we're looking at more like August or September on those things.
So when you all look into your crystal ball and you're trying to imagine, what's this going to look like in, say, September or October, what's the most challenging thing you still have to figure out in order to do things in the fall? What's the thing that would keep you up at night?
I think it's just numbers and seeing where cases go and what the state authorities decide to do with it. In a way, we're kind of at their mercy. They've been pretty good about putting documents and guidance out for us, but they contradict each other, the different documents, as you would imagine from government. And then they change. They can change week to week, and we're in a good spot at the moment, but like I just said, it could change in 2 weeks if numbers keep going up. So I guess my biggest worry is planning to do something, getting it started for 2 days, like the outdoor or the rec league Ken was talking about, and then having to shut everything back down. We have 700 plus kids in our soccer league. And I've already done one season of refunds for all 700 plus. I don't want to have to do it again in the fall. So.
Oh, yeah. Yeah, that's true. That's true. Gabe, isn't Minnesota opened up a bit more? I'm trying to remember. I thought I heard that it was, I'm in Washington and he's in Minnesota.
Yeah, I think Minnesota's opened up to what they call phase 3, which is closer to a normal resume to play. I think they can have bigger groups than just a 10 or 12 with teams playing together. I think face masks are still expected, by coaches and staff, and when you're doing a lot of things aside from the kids that are practicing. So, but then there's still a whole other phase 2 that would be phase 4 before they could get back to full regular play. In full group settings with contact and those kind of things. So easing up restrictions a bit, but again, one of those things where if things started spiking, they start regressing, and then I think you got to sit for 2 weeks at each stage when you're trying to move through them. Yeah. So if we're at stage 3 for 2 weeks, then we can move into stage 4, and then once we're in stage 4, it's pretty close to being back to normal play. So.
Ken says he wonders about the high school volleyball team he coaches. He wonders how they'll travel by bus to away games because you can't really practice social distancing on a bus with 25 kids. Yeah. Yeah.
But we've had no answer for that yet. We transport a lot of our kids, and one of the things in our re-upping and commitment for the year is, do you have transportation to and from games? Because right now, according to what U.S. Soccer wants, it says unless it's family members, you're not supposed to transport anybody.
Yeah, so much about carpooling, huh?
And we did a lot of that.
How far do your kids typically travel? You're in San Antonio, right?
Yes, well, we have teams that are in our local league at the lowest level, and then our upper teams travel all of South Texas. So think Austin, all the way to Houston, all the way down to Brownsville, Texas.
Oh, gosh.
So yeah, and so that's a huge area of concern. So most of our travel is San Antonio, Austin, that area.
That area.
But then again, we do have crossover games that go into Houston and Brownsville. So
right.
and I don't know how it's going to happen. I don't know what we're going to do yet.
Yeah. For a sense of distance, I actually grew up in the Panhandle, but they used to tell us it is closer to go from Texarkana, which is in the corner between Texas and Arkansas, closer to go from Texarkana to Chicago than it is to go from Texarkana to El Paso. So when he says he's going to Brownsville, that's not close.
Well, our big cities Austin is close. Austin is close because it's 75 miles away. Dallas 250, Houston 200, Brownsville about 180. So yeah, those are home game, home and away games.
That's like me coming to play at Steve's place.
Yes, yes.
Oh, and he's in another state.
Yeah.
So Kenneth says their local school districts all require players to travel to games on school-supplied transportation for insurance purposes. Maybe the insurance companies will change their minds. No.
So just no travel then?
I don't know. Catherine, do you have any sense of what your crystal ball says about insurance companies?
Oh gosh, I read something the other day, but actually I think it had to do with esports insurance. I think they're still trying to figure out what they're doing. I mean, it depends on the company, but when you're talking about underwriters, I mean, think about the insurance companies right now. As far as I know, it depends on the state, of course, but in Hawaii anyway, all of the insurance companies are operating from home. All of the employees of the carriers are, whether it's a manager or, a lower level employee, they're all working from home. And that may be different in different places, and that might be changing as people start going back to work. But, and then there probably, there is some work going on with insurance companies, I know, in terms of addressing some of these issues. But, they're acting in their own interest, and their own interest is going to be to have exclusions for things. It's not to pay more, it's to exclude more. So you have to remember that it's not going to benefit you, okay? And during a pandemic, just as if you were in a hurricane, you're not going to be able to get coverage that's going to help you during the pandemic. So it's your existing coverage and your existing contracts that benefit you. Like, keep in mind that Wimbledon, they were paying for pandemic coverage for years, paying millions of dollars every year. And they got over $100 million payout from their carrier when they canceled, because they foresaw that they needed pandemic coverage. Most organizations don't foresee this, and they don't pay for things that they don't think they need. And so they don't have that. So we in the middle of this hurricane or pandemic, you're stuck. I mean, all you can do is act reasonably and in good faith and do the, kind of adhere to all the guidelines and all the local and state and federal laws when you implement your programs, and be good at your enforcement of rules and consistent and act with reasonable care, and you're going to have to give up things. You're going to have to ask the question, what do we have to give up in order to have business continuity? I think that's one of the key things, because you're trying to have business continuity and continuity of your programs, but you're in the middle of a huge risk. So you have big problems right now, and it doesn't mean, but there's some things that you can always remember, that the courts don't like to interfere with sport. However, they might interfere with COVID issues. Okay. So this is kind of different. It's not the ordinary progression of, or ordinary play of your soccer game. It's adding this element that everyone knows is dangerous. And you also add this other element, unfortunately, is the parents' attitude about it, because you can't control that. There's parents that don't think masks are important and think that this is just a small flu, and that they think all of this is hype and that it's fake. And so you can't, those parents are the ones that might send their child that's like the ticking time bomb into play, and you don't know. So you've got some challenges, and I don't know that insurance is going to be the answer now unless you have the right coverage. But we wait and see on that. It's more of risk management.
In that scenario, if you have a parent that sends their kid to play, but say you had to sign a waiver or check off that your kid, didn't have anything and they seemed like they were clear, would any of that liability pass back to the parent because they knowingly sent their kid to do something that could infect other people?
Well, then if there is a lawsuit in relation to that, which is usually the parent, you're gonna file a cross claim or a counterclaim against that parent. Okay. And of course you have to prove that, but that's where you have to keep your eyes open. And if you hear things like a parent, is, not taking this seriously, you have to think of that as a risk and maybe have a conversation with the parent, because obviously the child is at, they're innocent in it, and but that parent may pose a risk to your organization, and maybe that's where you have to be more careful with those particular children of those parents, where you have to maybe have more of a conversation with them. But of course they're going to be wearing masks, and you're going to be keeping social distance until they've cleared, right? So when they come to the field or the area of play, they're wearing a mask because you're going to require that, and you're going to maintain social distance during that time while you investigate whether they're a risk to play.
Wow. So we want to welcome Bob has joined us. Bob, can you tell us a little bit about what's going on where you are with your sport?
Yeah.
I didn't warn him I was going to put him on the spot.
We just had our first one on Monday, and it's outdoors. It turns out it's outdoors, and I have them get their temperature read their oxygen, and ask them a series of questions if they feel well, etc., etc. And then we went ahead and played. We started off with masks, but it was so hot, we took them off and we social distanced.
So what sport are you playing and where are you located?
I'm in Massachusetts and I am playing volleyball, outdoors, sand
Out
volleyball on the
sand
sand
volleyball.
courts.
Ah, all right. We have Kenneth here who is in Pennsylvania and is also a volleyball person.
I think that's what we'll probably see a lot of is if there's areas that, regulate where the kids have to wear masks is that it's gonna be hard to keep them on kids if they're getting hot and sweating and running around if that is something that's going to be required by the areas.
You know, our governor just ordered folks to wear masks starting tomorrow, starting Friday. And I didn't look up how that applies to athletes on the field or the court. But it's basically if you're out and about, you need to have a mask on. So that starts here in Washington State tomorrow.
We just opened our gyms, and UFC gym is not requiring masks while they work out. 24-hour fitness is. You do have to wear a mask when you enter any of the clubs. We do have a mask wearing society here. Mask wearing has been mandatory in public 100% since pretty early on. And that's probably why we've kept our cases lower than 800 and why we only have 17 deaths. Mask wearing can be effective, and I think that helps a lot. However, playing with them is another story, but I've done a lot of research in the last couple of days about the numbers, where they are, who's doing well, who isn't, all over the world. And Vietnam is doing phenomenally well. I mean, they have, for their population, they have very few cases. And that's a mask wearing society. And, it's all attitudes and compliance and whether you have laws and whether people are going to comply.
So in your research, when you're looking at mask wearing societies, I love that term. Is it that socially people enforce that and encourage that, or is it a dictate from the government and people are just more likely to say, yes, I'm going to follow that rule?
It's a social thing. In Hawaii, we have a majority of Asian population, and it's an Asian custom that if you are sick, you wear a mask to protect other people. And so we often, so if you go to Japan, you see people wearing masks before COVID all over the place. And in Hawaii, it's interesting, over the years, I've seen people wearing masks all over the island at different times if they're sick. And I've even gone into a financial institution and seen an employee wear a mask, and she told me that she was sick and that she had to wear a mask the entire time that she worked and was sick. And so it's definitely infiltrated our society anyway. So when COVID hit, it was not difficult for people here to wear masks. It was like people didn't even question it. It was something that, that's something culturally that's acceptable to us. So it's not to others. It may be if you have more of an Asian population like Seattle would, and certain places like Vancouver or Canada would, but kind of depends.
Kind of depends. Kenneth writes, we're not requiring masks for participants. He's in volleyball in Pennsylvania. Our school will be requiring masks for coaches and anyone other than the players on the court or preparing to enter games. Steve?
Yeah, that's pretty much the same thing that the Oregon guidelines say, that wear a mask, face shield, or face covering when not actively participating in the sport. So yeah, coaches, spectators are all supposed to wear them. It's not necessarily a state requirement, but it may be soon. We actually did have the governor did order certain counties that they have to wear masks in public areas, indoor public areas, starting yesterday. Wouldn't surprise me if that went into wider effect here pretty soon too.
Yeah. Yeah. Wow. Wow. Joel, do you have any mask wearing requirements in Saskatchewan? Or
No, we don't. But people were wearing them a bit more off the start, and some people still wear them. But right now in the city that I live in, which is about 225,000 people, like we don't have one case in the entire city, so people are wearing them less, I guess.
oh, geez, now I need to learn hockey and go move to Saskatchewan. My neighborhood is where the first cases were found in the U.S., so I'm kind of at ground zero, and we take it awfully seriously in my neighborhood.
Are you in Kirkland?
No, I'm in Snohomish County, which is just north of Kirkland.
Okay.
Yeah. Kirkland got a lot of press because they had the second round of cases, and they really struggled with their skilled nursing facilities. But the nursing, my dad's in a retirement community, and they've all been tested, all the residents, all the staff. They have had just very strict lockdowns. The residents are called every day. Every day they get a call from the staff, and none of the staff and none of the residents have tested positive, and they're in North Seattle. They're, a high-risk community because of the way the building is put together, and because, like my dad, he's going to be 87 next week. Lots of folks who are vulnerable. So measures can work to keep people safe. I mean, I haven't seen a lot of my dad. I can't see a lot of my dad, but I know he's safe.
I have a comment to make about the mask. I've been trying to buy N95, KN95 masks, and you can't. Up until recently, you couldn't buy them anyplace. And they do help the hospital people. They prevent you from getting it, and that's what the hospital people wear. So they must protect you some, or they wouldn't be wearing it in the hospitals. So now you can buy them on Amazon and so forth for like 80 cents a piece. But you got to be careful because some of the masks do not meet the regulation. They're not ASTM approved. They don't meet the 95% removal. And the reason I like them, they have 5 layers. They don't have a cloth. They have a activated charcoal in the middle. They got a bunch of 5 layers. So if it's good enough for the doctors, I think it's good enough for me. I want to protect me.
Oh.
You can buy filters. I ordered filters actually I ordered N95 masks I think it was in January because I was going to go to Vietnam. And I have N95 masks, but I haven't worn them because they would be kind of politically incorrect, or like, when we were going through that shortage of PPE at hospitals and stuff, I didn't want to be walking around with an N95 mask. But I do have a lot of surgical masks that I wear. But I also got all these filters that I ordered. It took 2 months to get them from Amazon, but the filters can be placed in the cloth masks. And obviously, wearing masks, you're protecting the other person from you, not necessarily protecting yourself. So it's dependent on everyone wearing a mask, not just one person.
Yeah. Yeah, I find it fascinating that socially, whether it's our communities or our states, and our reaction to masks, are they just something that happens, or do we have? I know there are a couple communities I work in where masks have become almost a political battle, which just makes me sad. I think it takes away from the point of trying to keep people as safe as we can. Well, do you all have any questions you want to ask of each other, advice you'd like, a sticky problem you're trying to solve right now while you've got folks here who'll help you?
We do have one from Facebook I was going to put up. We had Mark, who's a cross country coach, actually asked about, liability and the ability to have outdoor cross country meets in Minnesota, or cross country running meets.
Does he talk about what kind of liability he's worried about in particular?
I don't think so.
Okay. So what kinds of liability concerns, I guess we'll ask Catherine to help us with this. What kinds of liability concerns what are the questions you would suggest he ask as he tries to figure that out?
Well, okay, this is where in Minnesota, what place is it?
Cross country in Minnesota.
It would be in the fall, so it wouldn't start for another couple months here.
In the fall, okay. One thing that is present in my mind with outdoor sports is that the virus is very fragile in outdoors, and so if you're talking about a cross country meet, let's see, you're running and there might be some packs, of course, because and people passing each other and stuff. But I would also I would be concerned about, is the air stagnant or is there trade winds, or, because in Hawaii, we don't have much of a problem outside because of winds. But I think if you're in a a place that's a lot more still, the air is a lot more still, that would make a difference. So I think I would have them kind of research for that area what the incidents of getting COVID outside are, and to assess the risk. And then in terms of liability, we'll have them sign liability waivers that are updated to include COVID, do things that are reasonable, like James mentioned, things like taking their temperature. I like how James set it out, like he has a really good program and like very consistent way of allowing people to enter the field of play. But I think the main thing is probably when they have that original assessment, I think there has to be a presumption, I think, that they have COVID when they come to that assessment, and social distance them in line, like 6 feet apart while they, enter the line, have them wear masks, and then take their temperatures, ask them a series of questions, maybe find out what the CDC recommends in terms of questions, there might be questions that are recommended by the sport or by your national governing body or whatever, and make sure you adhere to all those guidelines, adhere to all guidelines, and be very studied in those guidelines of what you need to adhere to, follow them, enforce them, don't let any exceptions occur, and you decrease your risk of having someone contract it. You have to be more concerned about making sure people are safe, almost more than liability, because in keeping people safe, you're addressing that liability issue. You know what I mean? Like if all you can think about is lawsuits, you're not actually going to be taking as much care of your people as if you really care about the people. And so I think it's an attitude of safety and being consistent with that attitude of safety. And then when it gets down to it, if someone does contract COVID in the course of play, like in a cross-country meet or practice, then the question is always going to be, what did you do? What did your organization do to try to prevent that? And how did that happen? I mean, maybe the person came in, they were asymptomatic, and they answered honestly to all the questions. I mean, what can you do? You weren't negligent for doing what you did because you adhere to every guideline. But however, if the person mentioned that, oh, I have a sore throat, and you go, well, that's okay, and you can play anyway, that's another story. So I think, I think that it all comes down to reasonableness and caring for the players and the participants.
And Ken says, just wondering, what is a good thermometer to use for checking 25 to 35 people prior to a practice, preferably non-contact? Does anybody know about thermometers? I'm not a thermometer expert.
Well, they, you know, you can buy those, the thermometers, or the, you know, the ones that, like even Apple stores, if you go to an Apple store, if you want to go inside, you have to have your temperature taken by that electronic thermometer. And they sell at Costco for like, well, they sell it at CVS for $72. And they probably are cheaper at Costco, probably by half or whatever, but you could get a few of those, and I would think those would work pretty well.
You know, I think a couple weeks ago, Rob Marino had purchased a bunch of thermometers and equipment. Gosh, and I can't remember what he said they cost, but he had stocked up to have his kits ready for checking people into his practices and games.
Yeah, I bought one from Amazon, and it just come here within less than a week, and it was around $60, $70. It's an infrared. You just point it at them. And another thing they're saying, if you're low in oxygen, you know, those things that measure your oxygen, that's another way to tell, because your lungs get congested, so you're low in oxygen if you have the COVID. So I test them for oxygen too.
Both. All right. Are there any other questions coming off of Facebook?
Let me check here. I did see Mark post an update. He said they're doing all of what you guys suggested right now, during summer workouts, temperature, social distancing. The questions and runners are doing waivers. So it sounds like doing everything right now for any summer practices or captain's practices. So seems like the theme is to do everything right and then make sure that you can prove that you're doing everything right. And that way you've got, you know, possibly less liability if anybody gets sick.
So this is what he's talking about. This is a pulse oximeter. Oximeter. Can't pronounce it. Anyway, I bought this because I don't know. There was one of the talk show hosts said that when he got COVID, that he was told that if he bought an oximeter, a pulse oximeter for home and tested his oxygen every day, if it got to a certain level, then he should go to the hospital. So I thought that was handy. That was a good idea. So I ordered one on Amazon for like $25 just to have it in case, because it's good to have these kind of home medical things, especially. I also considered the fact that maybe I wouldn't want to go into a hospital if I was sick, because I could potentially contract it. So I thought it was better to be able to test these things on my own. And so I don't know about, like, I mean, I have heard that that lay people doing this may not know how to interpret the results, or that they might do it wrong. They might like implement it wrong or whatever. But I figured like, oh, maybe I can figure it out. I also know that nails like this, that they impede your ability to get a good reading.
Yes. Oh, well, we are running down on time, but I want to close out with saying, James, I am sorry you caught the COVID, and I am really glad you are out of the hospital and you're back with us. And I hope you continue to feel better.
Thank you. Thank you.
Thank you for joining us today. It was good to see your faces and hear your voices and read your typing, Ken. We're glad you joined us. Thank you.
Thanks, everybody.
Okay.